This segment is sponsored by the Kaplan Center for Integrative Medicine.
Well, this morning I'm in McLean at the Kaplan Center for Integrative Medicine, where they treat chronic and very complex conditions that you don't often know are treatable. And so today I am with Dr. Kaplan himself, who is the founder and medical director here. First of all, thank you so much for taking time to speak with me this morning.
Thank you for having me on the show.
Yeah, so I think the first question people probably ask you is, what is integrative medicine?
So integrative medicine is about combining the best of different cultures and different forms of medicine. So here, for instance, we're well-versed and well-grounded, obviously, in conventional medicine, but we also do acupuncture. We also do osteopathic manual therapy. We'll do herbs taken from some of the Oriental as well as the American medical systems. So it's about kind of combining the best of everything in order to get the best results for our patients. It also allows us to have some very different perspectives on patients. So when you're trained in a certain medical system, you're trained to hear certain things and ignore virtually all the other information if it doesn't fit. So you tell me you come in and you're waking up at 3 o'clock every morning, all right? From a Western standpoint, we give you Sonata, and that's a short-acting hypnotic to get you back to sleep. But from an Eastern standpoint, it says, wait a minute, transition from liver to lung isn't working so well. Maybe there's congestion in lung, or liver rather. In which case, what we're talking about is probably some issues with anxiety. So now what we're doing is we're addressing a more fundamental issue with you as opposed to just covering up the symptom.
So what are some common conditions that you encounter here at the Kaplan Center?
Well, people are coming in with a whole range of things, including brain fog, difficulty, focus, and concentration, POTS, postural-orthostatic tachycardic syndrome, and so headaches. And interestingly enough, the big ones are probably fatigue, headaches, sleep disturbances, okay? But then there's a whole range of other things that go along with that. And what the commonality in this, especially in the post-COVID, that we see a great deal of at this point in time, is there's an inflammation in the central nervous system. Okay, the immune system has become out of balance. And this is common not just to post-COVID, but it's common to chronic fatigue syndrome. It's chronic to the PANS-PANDAS kids that we see. It's common to the post-treatment Lyme syndrome that are continuing ongoing infections. It can also be common in treatment-resistant depression. We have a whole new concept that's been developed in terms of neuroinflammatory diseases. We used to think of these things as unrelated, and in fact, they're quite related, and very commonly related as an infection that sets off the problem. We have to think about these things differently. We have been pioneering this process for 30 years here at the center. We've hosted a couple of international conferences on this problem, and I've written a couple of books on this issue. So this is something that we're finally coming to realize, and more importantly, is it gives us a different set of questions to ask. It gives us different insight into how you got sick and why you're still sick. And most importantly, it gives us better information on how to get you better.
So for people who maybe, are having those symptoms that you just mentioned, and they're like, no, I'm not going to see a doctor. What would you say to them?
A lot of the people we're seeing have been sick for a very long time. Okay? And unfortunately, they've been dismissed many times by many other practitioners because the labs are normal. Okay, if your labs are normal and you're not, the answer is we didn't run the right test. Many people who've been sick for a long time and return them to total health. That's the goal, because we want you living a long, healthy, vibrant life.
Absolutely. So I think the message here today is, take advantage of the Kaplan Center. You guys offer these great opportunities for people to really address their pain, address their symptoms. So there's no need to wait. So all the information is on your screen right now if you want to make your appointment and speak with Dr. Kaplan here. Doctor, thank you so much for taking time with me this morning.
Pleasure. Thank you for having me on.
My pleasure.